Next, let's queer up health. Urgent warning to the gay community as STIs are an out-of-control crisis. The United States is grappling with an alarming surge in syphilis cases, which have increased by 80% over the past 5 years. According to the Centers for Disease Control and Prevention, CDC, more than 2.5 million cases of chlamydia, gonorrhea, and syphilis were reported in 2022, highlighting an escalating sexually transmitted infections crisis. CDC Director for STD Prevention, Bachman, emphasized the need for immediate intervention, noting a significant rise in primary and secondary syphilis, the disease's most infectious stages. Bachman revealed that the cases of primary and secondary syphilis increased 10% in 2022 alone and 68% since 2018. Although curable with antibiotics, syphilis poses a severe risk to babies who contract congenital syphilis during pregnancy at birth. Over the past decade, rates have surged by 937%, a figure Bachman described as alarming. The data showed that American Indian and Alaska Native people experienced the highest rate of congenital syphilis, while Black and African American peoples accounted for nearly 30% of the cases in 2022. The report revealed a staggering 183.4% increase in congenital syphilis cases over the past 5 years and nearly a 31% rise from 21 to 22. The medical alarm particularly urgent for the LGBTQ community, as studies show that with a wider acceptance of PrEP, the use of condoms among the gay community has decreased dramatically. The National Coalition for STD Directors has labeled the U.S. STI epidemic as, quote, out of control, end quote. Okay, well, first there's two stories here. One is dealing with congenital syphilis, and there's a lot of headway being made, especially down here in Florida, and that is anybody who comes in pregnant needs to be tested for syphilis, because, and not just initially, it's throughout the pregnancy. On top of that, yes, our STI rates are increasing, both in the heterosexual community and in the gay community. So we have to do better. Our hospitals need to do better for testing. We need to standardize, and we need to have an approach that can easily talk about it. We shouldn't be embarrassed to talk about, okay, yeah, we had sex over the weekend and something might have happened. And it's okay to talk to your medical provider about it. And I think that we can do much better as medical providers, hospitals, to normalize the conversation and consistently push to get tested.
That is very true. I will say a call to action to our community. We have to stop shaming each other for wanting to use condoms during hookups. If this applies to you at the table, then let a hit dog holler, because if somebody pulls out a condom and you turn up your face, that's an issue.
Yes.
That is a person that's wanting to practice safe sex just to protect themselves, and also you, because you don't know what that person is bringing to the table. So they just want to be safe and have a fun encounter. So this shaming of condom usage and you thinking you have all the know-how and trying to convince another person to not be as safe as they can be, we got to cut that out.
Right.
That is getting foolish at this point.
And I also want to add that if you are sexually active, you should talk to your medical provider about PrEP, post-exposure prophylactic PEP, and and also doxyPEP, which is the antibiotics that will combat relatively effectively against several STIs.
If used appropriately.
Yeah.
Absolutely. Speaking of, sorry, I don't mean to cut you off. When you say if used appropriately, for doxyPEP, for those who use it, I hear you want to use it generally 24 hours after a hookup. Is that true or false?
So I think it's 2 pills, I believe.
Yes.
And then, but there are people that are trying to take it on a more regular, more frequent basis. And, you know, there's that 72-hour window between taking the pills. So it's a matter of, if people take it and they're taking it regularly and then they're not taking it and they get exposed and they didn't take a pill, you know, at some point there could be resistance being built in the system. And that's the concern that we're hearing from lawmakers and legislation, and that we could be changing, you know, we could be risking building a resistance to the medication.
Also constant ingestion of like antibiotics is certainly just not good for your system at all.
No. Not what they were meant for.
That's right, because my husband's a pharmacist, and he is aware of cases where people who take doxyPEP they start building an immunity to it.
Right.
And they are conflicted with another ailment, which doxypep, that ingredients would be used for, but they can't use that medication because they built up an immunity to it.
Right.
So that's something we also have to be careful of, being gluttonous with all these pills.
It comes to talking to your physician again, talking to your medical providers, get an understanding of what needs to happen if you have a sexual encounter and you're like, hey, I need something. It's a simple phone call.
Right.
It really is.
If you slice your thumb, you need a Band-Aid.
Right.
If you suck a peen, you need a pill. Hello.
There we go. There we go.
On that note.